Welcome once again to Along the Rio Grande. I'm George Torok, and today we'll be visiting with Barbara Dent from the El Paso Medical Society Alliance, and she was one of the people that worked on a new book called The Caregivers, El Paso's Medical History, and Barbara's going to tell us a little bit about how that book came about and tell us a little bit about the history of the medical profession in the El Paso area. Barbara, welcome to Along the Rio Grande.
Thank you.
How did you become interested in medicine? What's your background, and how do you end up in El Paso? Are you a native El Pasoan?
Oh, no. I'm originally from New Orleans and married to a physician, and we moved here in 1966. I'm an x-ray technician by profession and very interested in history, and we started a medical museum here, and that's how it all started.
So you've developed out of your own profession, you were able to develop an interest in sort of how the whole profession developed in this area.
Yes.
And became interested in overall medical history as well. You've worked in a number of different areas, a number of different parts of the field?
No, just x-ray.
Just x-ray.
But as the curator of the medical museum, it's been a lot of fun researching all the different equipment and stuff.
Okay. Let's talk a little bit about the El Paso Medical Society, how that got started. What's the origins of that?
Well, after the Civil War, we had quite an influx of people. The doctors came here with the Army, number one, with the railroads, number two, and also for health reasons. It was a good tuberculin center. It was nice, high, dry, hot air. And they wanted to improve the profession. They wanted to band together and study and police the profession.
So we're talking about maybe the 1880s, early 1890s, after the railroad population starts to grow. This is when some of the earliest physicians start to come to this area.
Well, actually, one of them came in 1868, and that was Dr. Elwood White. He came with the Army, but he left and then returned. There were a number of doctors in El Paso in 1898 when the society actually started, and it might have been because of Dr. Elwood White's funeral. But because of his funeral, they joined together to go to the funeral, and then decided to become a society.
So you had probably a number of doctors that were in and out of the area before that, and they start to settle more in the 1880s, and this is how the idea for the society comes about. In the book, it also mentions the El Paso Heritage Foundation. What
yes,
is that connection?
Dr. and Mrs. Werner Speer started this Medical Heritage Foundation, and it's a 501c3 tax-exempt public fund that we can maintain the museum, and people can donate to us, and it's tax deductible.
Oh, I see. So this is a way to preserve some of our area medical history along with the book. We also have collections and things that we'll talk a little bit about later. Okay. How did the idea for a history of medicine in the El Paso area come about?
Well, there are histories of everything else in El Paso. And our history was scattered in all different kinds of places, and you couldn't go to one spot to find it. And so we began collecting them around 12 or 15 years ago, and getting the histories of the hospitals and photographs and things like this. And when Dr. Toon was president of the society in 1997, it was his idea to write the book and get it all under one cover.
And this would be in preparation for the anniversary?
For the 100-year celebration.
So it covers really 100 years of medical history in the El Paso area. And
well, a little bit more.
Beyond that as well. What was your role in this publication?
They utilized all my research.
I see. So you were instrumental in putting some of these collections together and gathering things?
Yes, yes.
Okay. What other people were involved in writing the book? Because there's a number of different sections and a number of different people.
Sherry Speer, and Barbara Funkhauser is the author, and she was the editor of the El Paso Times for a number of years. And then Dr. H.D. Garrett, Snuffy, did a number of articles. And then Dr. Toon was interviewed, Dr. Barone was interviewed, Pete Diorati was interviewed, and a number of other people were interviewed.
And you have some sections that were written by different people. Some things
Yes.
were kind of combined and put into a narrative. There's some artistic works in the book as well.
Oh, by all means, the photographs are beautiful, and Cisneros is one of Cisneros' drawings is in the book. Michael Moses at Sundance Press designed the book for us.
And even Leon Metz, played a role in this. He seems to be involved in every
yes.
history project.
Leon Metz was kind enough to do the introduction.
What kinds of records and sources did you start to gather as you're thinking of how to put together a whole history of medicine in this area? What kinds of records were there?
Well, originally, there was a hospital, not originally, but there was a hospital named Ralston, and it was in the 1920s, and it sold to the Masons, the Masonic order. And so it became the Masonic Hospital, and it was over on 5 Points, where the police station is now. Well, when the Masonic Hospital closed in the mid-1940s, they transferred and brought all of their records. I mean, all of their records. All their patient records, their logs and everything. And we had them in the basement of the Turner home. And one day, the fire department came by and said, no, you can't do that. So we did keep all of the ledgers. And so we have all of the ledgers of the surgery and admissions and births from Masonic Hospital. Then we also have the doctor's registration ledgers from the district clerk's office, which began in 1878. That's when they began to register.
And this is when doctors would come to El Paso to practice. They would have to register.
According to the
so
state.
we have a fairly good idea of how many people were here and what years they practiced, and all of those are preserved there.
Yes.
Okay. Have people brought other collections of records to you over the years? Do we have other things?
Yes, we do. There was an organization called the Southwestern Medical Association, and it ceased operating in, I guess around 1969, and we have those records and their scrapbooks. We have all of the, it used to be called the El Paso County Medical Society, or the Women's Auxiliary to the El Paso County Medical Society, and then it was changed to just the society when we started having men spouses of female physicians. And now it's been changed to Alliance. But we have all of their press books dating from 1922. So
and these are newspaper clippings?
Yeah, these are
files,
newspaper clippings and letters and things
so that
like
gives you a pretty good, at least in the more modern history, that gives you a pretty good range of sources to work with. Interesting. There's a very long history of medicine in our area that really goes back even before the arrival of the railroads or that. I noticed that the book talks about some of the early Spanish explorers and some of the problems that they dealt with.
Yes.
I understand that there's some people even in the 1500s that are practicing medicine in the Texas area to some extent.
Well, Cabeza de Vaca. There's a lot of controversy if he actually came in the area, but it is believed that he came as far west as Presidio. And he performed the first surgery in Texas. He removed an arrowhead from an Indian's chest, and so he's claimed the first surgeon in Texas. And Tom Lee was commissioned a number of years ago to do a painting of this by the Texas Surgical Society. The original hangs in Galveston in the University of Texas Medical Branch Library, but we have a signed print at the Turner Home, which we're very, very proud of.
And along with Cabeza de Vaca, you have a number of other Spanish that passed through the area. And Dr. Porter, there's an article by Dr. Porter in the book as well that talks about some of the problems.
Yes, about all the diseases that were brought over by Western civilization to the Indians or to the natives that were here. And the mixing of the two cultures and the mixing of the two problems, and also the mixing of the two treatments, because the Americas gave the Western medicine 240 other medications, natural medications.
So there was quite an exchange there.
Yes.
of cures and treatments
Yes.
for various diseases. Coming back up into the 19th century, you mentioned the fact that some particular ailments drew people to this area, and that there were kind of chronic problems with things like tuberculosis, for example. Let's talk a little bit about that. How does that become part of El Paso's medical history?
Well, it brought a lot of people here, number one. We had two kinds of patients that sought high, dry air and clean air. One, we called them the Skinners and the lungers. The Skinners were people that had all sorts of skin ailments, and the dryness helped dry these ailments up. The lungers came out here with tuberculosis or with emphysema or something like this. It was, in the treatment here, they would get sunshine, they would get rest, they would get food. But we had all sorts of sanitariums here that sprung up. We also had tent cities. People just camped out down in the plaza. And so it was, a number of doctors came here for their own health, and a number of doctors came here for the health of somebody in their family, whereas a lot of people in El Paso came that way.
And this was something that area doctors started to specialize in after
Yes,
a while,
they did.
drawing these
Yes,
two
they
groups
did.
of people. And as far as tuberculosis, what would happen to people after they were exposed to this climate for a while?
Well,
Their conditions improve?
It improved drastically. And then as surgery improved, they started doing other kinds of treatments. And we had the sanitariums all the way up until, oh gee, I guess into the 50s, 1950s, and when they developed powerful antibiotics to kill the tuberculin germ.
So this is something that for a very long time into the 20th century drew people to the El Paso area for health reasons. There were a number of other problems in the early 1900s that are mentioned in the book that El Paso had to deal with, different types of epidemics, flus, etc.
Yes, well, we had, of course, we had the 1918 flu right after World War I, and that is recorded in the book about how many civilians as well as how many soldiers died here in El Paso right after the flu, right after the war.
This is an epidemic that killed more people than the war itself by the time it was over worldwide. And El Paso had to deal with large numbers of those cases. And I imagine people returning from the war were bringing it back with them as well into the military installations here?
Yes, and vice versa. Another epidemic was typhus, and this caused quite a commotion with the border because they would force the people crossing into Mexico they actually closed the border, and everyone crossing in would have to take a bath and have their clothes fumigated. And one incident, which was very, very sad. They were fumigating the jail with kerosene, and one of the inmates lit a match, and quite a few of them died, burned to death. But a funny incident was that as they crossed the border, they were given and were bathed and fumigated. The people from Mexico were given a card stating that they had been fumigated in the past 10 days. And they caught this one man. He had taken 10 baths for 10 different people.
So even then there was a problem with
That's
documentation
right.
at times. Along with some of these diseases and along with some of these resorts and sanitariums that develop, there started to be a number of different health institutions. A number of our early medical facilities started to develop. And, you know, one that people may have heard about that they spend some time talking about in the book, Hotel Dieu. Well,
Yes.
What's the origins of that? Because that's a very interesting story.
Well, until the sisters came, we really didn't have a real hospital. We had the pest house, which was in old Fort Bliss, and people were just sent there really to die. And then the nuns came and they built Hotel Dieu.
And where are they coming from, and when would this be?
They came from Missouri.
Okay.
And the original building that they had was over in Sunset Heights, and then they bought the property in the 1100 block of North Stanton, on the corner of, let's see, I guess Rio Grande and North Stanton in Kansas, that whole area. They came in 1892 or 1890 and built their hospital in 1892.
And this started to provide care for all of these different conditions we've
Yes.
talked about? Was it a general facility open to the public?
Yes, it was. Yes, it was, definitely.
And
they also got the first X-ray machine. You know, X-ray was invented in or discovered in 1890, and before the turn of the century, they too had an X-ray machine.
And people that worked at this facility, the sisters, they were trained in medical procedures. Did we start to have doctors affiliated with that?
Yes.
In particular?
They started a school because they really needed a nursing school here. So they started a school, and it was the first 3-year program of School of Nursing in the state of Texas. The first school for nursing in the state of Texas was at John Seeley Hospital in Galveston, which is now the University of Texas Medical Branch. And then it continued on as a 3-year school until around 1969, 1970, when they sold their school to the University of Texas at UTEP. And so then it became a degree school.
And in the early years, they were training people in nursing here, where some of these people eventually went off to other places as well. Were we training people for other parts of the state?
Oh, yes.
So they produced a large number of graduates over the years.
Yes, and also Providence Hospital started a nursing school, and then Masonic Hospital, Ralston had a nursing school, and when Masonic took it over, they too had a nursing school. And then Thomas and General had a LVN, a licensed vocational nurses program, and then of course the community college, El Paso Community College, has their nursing school.
All right. We'll come back to that in just a minute. How did the other hospitals start to develop after that? Which ones start? What were some of the earlier facilities along with Hotel Dieu?
Well, then Providence Hospital, Dr. Schuster came down to practice at the smelter. And he's from Austria, and he came down. He wouldn't come until they provided him with a hospital. There was a hospital on the smelter, and he stayed there until just after the turn of the century. And he and a group of other doctors opened up Providence Hospital. They bought an old technical school, which is no longer there. As you go I-10 west, just as you turn, make that big bend in I-10, going towards Sunset Heights, that's where the hospital was. Oh. And so they had Providence Hospital. And then Dr. Baldwin came from New Orleans. He had tuberculosis, and he started the Baldwin Clinic. And Dr. Holman eventually bought the Baldwin Clinic from him, and then he built, or he and a group of other doctors built Southwestern Hospital. And the Sisters of St. Joseph, the Catholic diocese, bought the old Holman Sanatorium. And the Sisters of St. Joseph were there working, and it was their hospital until they built a new one, And now you can still see some of the steps, because this is where the Cancer Treatment Center is now.
Oh, okay. So by the 1920s, there were a number of different
Oh, it had
medical
lots of
facilities.
hospitals, yes. Many, many.
And we mentioned earlier healthcare education. Certainly, you know, Hotel Dieu played a role in that. But by the time we got into the mid part of the century, UTEP had taken an interest in it, and you talked about the programs developing there. El Paso Community College wasn't around in the 1950s and 60s, but by the 1970s, they're involved in health education
Yes,
as well. How does that come about?
Well, this was a very interesting situation. I interviewed Dr. Lamb from the community college, and when the community college started, they wanted to have an allied health field. Mm-hmm. And I think one of the first classes that they had was dental assistance and lab tech. But the Operation Hope, which was started right after World War II by Dr. Welsh, he decided that he would take a ship, a hospital ship, out of mothballs and outfit it and send it to third world countries, not only for the care of these patients in these countries, but also for health care training. And he would have personnel in all allied health fields. And so they would go and stay for 6 months at a particular place.
So this was a large ship that served as kind of like a hospital and the training session and all of that?
And then they discovered that they could help more people by having land-based facilities. So they decommissioned the ship just about the same time that community college was starting. And so over at the Rio Grande campus, the X-ray department has the equipment from the hospital ship Hope. The dental lab has some of the equipment, the medical lab, and the surgery suite. All
so this
have
is
part
what
of the hospital
kind
ship
of provided the whole basis for
right.
our different health degrees that we work today, much of that equipment.
And this was the first time that Hope had ever helped or had ever done anything on the U.S. ground, because it was always for the other countries.
We also talk about some of the Hispanic medical professionals. Most of the people that we've been talking about so far were Anglos, or at least of European descent. We also have some Hispanic professionals that come into the picture by mid-century. How do they get organized?
Well, until just recently, they all belonged to the same organization, and there was a lot of crossover between Juarez and El Paso as far as socializing.
So there were doctors from Juarez that were part of the medical association.
Dr. Samaniego was one of them, and he's the grandfather of our present sheriff. And just recently, the Hispanic physicians have formed together and formed an organization called SWAHOP. And then the Puerto Rican physicians have joined together now and have formed another organization. They have common interest, and SWAHOP is providing a service, as well as Texas Tech is providing a service right now that kind of went out of vogue a few years ago. I mentioned before the Southwestern Medical Association. The reason that was formed was to keep doctors abreast of new procedures and new developments. And so they would meet in basically their own communities close by, and wouldn't have to travel all over. District 1 of TMA, Texas Medical Association, also had this. And so you knew a lot of the local doctors. And
this provided kind of a seed for bringing some of the Hispanic doctors together and allowing...
Well, then there was no need. Transportation became so good that they didn't have to have these educational programs to keep abreast, because they could go to the main programs. Well, now, since everybody has to have continuing education, we have gone right back into, let's have it here locally. And so SWAHOP does a wonderful job in bringing in professional people and having excellent meetings, and as well as Texas Tech.
We only have a few minutes left, but I want to talk very briefly about the museum, because this is something that probably many people are not aware of, that there is a medical museum.
Yes.
What kinds of things can people see if they come to the museum?
Oh, all kinds. The Medical Museum is located at 1301 Montana, and it is the office building of the El Paso County Medical Society. It's an old home. It was built in 1910 by Dr. S.T. Turner, and he donated the home to the Medical Society. We have an iron lung from the old Hotel Dieu emergency room. The last time it was used was in 1953, when the last big polio epidemic was. We have a lot of the cathode rotating, or a lot of the cathode X-ray tubes from Hotel Dieu. We have some old microscopes. We have, it's divided into 4 rooms. We have the pharmacy that used to be down at the Mills building, the old Schaefer Pharmacy, which is a fantastic exhibit.
And there's examples there of some of the different medicines and treatments.
And labels of different pharmacies here in town and in Morris.
I understand there's also some information about some of the nursing schools, some examples.
Yes,
of some of
we have a collection of dolls that show what the student nurses used to wear in the different hospitals that had other different schools of nursing here in town. And
if someone contacts the Medical Society, might they be able to come and see the museum?
Yes, it's strictly by appointment.
Okay.
Because the building is very hard to get into. It has many steps, and the museum is on the 2nd floor. So we have no elevator, and so we have to let you know this, and we like to take you through, and it's kind of a show and tell type thing.
Okay. The book is The Caregivers, El Paso's Medical History, and how can people get a copy of this?
We have it at the Medical Society building at 1301 Montana, and the telephone number is 533-0940.
Well, thank you. I want to thank you very much for coming in and visiting with us today and telling us a little bit about El Paso's medical history. And we want to thank all of you as well for joining us here today on Along the Rio Grande, and we hope to see you on our next program.